The House Appropriations Subcommittee on Health and Human Services is called to order. Clerk, please take the roll.
Chair Morse,
Here.
Vice Chair Martis,
Here.
Representative Hood, Representative Brabeck, Representative O'Neill, Representative Puri, Representative Farhat,
Here. Oh, sorry.
That was the weirdest representative voice I've ever heard.
I got you, Rep. Price. Representative Skaggs,
Here.
Representative Snyder,
Here.
Vice Chair Green,
Present.
Representative Bolin, Representative Meerman, Representative Kuhn,
Here.
Representative Steele. Madam Chair, you have a quorum.
Thank you, Clerk. Rep. Hood moves to approve the minutes of November 1st, 2023. Hearing no objection, the minutes are approved. Welcome, everyone, to the first meeting of the 2025 budget for the House Appropriations Subcommittee on Health and Human Services, which, as we learned this morning, represents 46.7% of the state's budget. It is extremely critical for the citizens of this state. It represents direct care that we provide, and this committee considers it a huge responsibility and an opportunity to impact the lives of Michiganders. So we look forward to this morning's presentation by Director Elizabeth Hertel, Department of Health and Human Services, and Amy Epke, who is our Senior Deputy Director of Financial Operations Administration. Please join us and make sure your mic is on. Thank you.
Good morning. Thank you for the opportunity to be here today to discuss the Governor's fiscal year 2025 budget recommendations for the Michigan Department of Health and Human Services. Again, my name is Elizabeth Hertel. I'm the director, going on my 4th year in this role, if you can believe that. And today, I am very proud to be joined by my leadership team from the department. I'm going to run through everyone very quickly. This, again, is Amy Epke, Senior Deputy Director for Financial Operations. I didn't write everyone down. Matthew Rick, Senior Deputy Director, Legal Affairs. Beth Nagel, Senior Deputy Director, Policy and some other things. Sarah Lyon Callow, who's our Senior Deputy Director for Public Health. Megan Groen, who's our Medicaid Director. David Kniezek, COO. Emily Skripchek, I almost said Schwarzkopf, Chief of Staff, we have over here. Eric is over here. We have blank. Pete Blank, who's Sarah's Chief of Staff. Dwayne Haywood, who's our Senior Deputy Director for Economic Services. Jean Ingersoll's over there, our Chief Deputy now for Administrative Services. Sharday Burton, who is our Director of Legislative Affairs. Laura Blodgett, who's our Communications Director. Demetrius Starling, our Children's Services Director. Lisa Gross, who works with Demetrius and Children's Services. Dr. George Mellows from our state hospitals. Eric Eklund, who just joined us in financial operations. Sue Kangas, who has worked in financial operations for a number of years. And Lou Robo, who is getting closer and closer to the door as his time runs out, currently Senior Advisor on Human Services. So thank you all very much for being here with me today. Last year, when we came before this committee, I spoke about this administration's focus on tackling the challenges that people face each day and our commitment to helping our friends and our neighbors address these challenges and putting Michigan on a path to a brighter future. With your support, we have made significant progress in many areas, some of which I will highlight today. Still, I know that there is more we can collectively accomplish. The fiscal year 2025 budget recommendation before you continues to move our state in the right direction by providing investments that support initiatives to keep kids safe, to expand behavioral health care access, to strengthen our Medicaid coverage, to assist families, and to support the healthcare workforce, and finally, to make a difference in the lives of our friends and neighbors across the state. So today, I'm going to cover 4 areas. First, I will provide a brief update on the services that were previously funded through the budget. Then we can talk a little bit about the status of several of our current fiscal year investments. I can provide a high-level overview of the proposed fiscal year 2025 recommendation, which will break down by fund source. And then finally, I'll spend most of my time outlining some of the investments that were proposed in the governor's fiscal year 2025 executive budget recommendation. Before going any further, however, I just want to center our discussion around the department's mission. That is to provide services and administer programs to improve the health, safety, and prosperity of the residents of Michigan. Everything that we do is centered around improving the health, safety, and prosperity of our fellow Michiganders. We take great pride in this work, and I'd like to take a moment to thank all of our employees. The department employs roughly 15,000 people, and we serve in all 83 counties, working closely with your constituents to provide services to infants, children, adolescents, and adults of diverse backgrounds in rural and urban areas across the state. Whether that is making vital records available, working on programs that improve access to health care, meeting foster care needs, supporting food assistance, testing the water that's coming out of your taps, or any of the many services that we provide, the people that work here are great public servants, and I am proud to work with them. This slide illustrates some of the many ways that we make a difference for people throughout the state. For some context, I would just like to remind everyone that Michigan has a population of about 10 million people. So to highlight just a few, state and federal programs administered by the department help more than 3.3 million people put food on the table, cover child care costs, and keep utilities on in their homes. Over 160,000 calls, texts, and chats are received annually through our behavioral health crisis lines and peer warm lines. Just to give a little perspective on that, that is greater than the population of the city of Lansing. Yet each caller is given individual attention and support based on their unique situation and needs. 3.2 million people, including 1.25 million children, received health care coverage thanks to the budget passed last year by the legislature. Almost 2,000 children were reunified with their parents or primary caregivers last year. As we move throughout this presentation, you will hear me speak a lot about my priority to keep kids safe. When children can be reunified safely with their parents, that is something we should all be proud of. And again, these are just a few of the ways that the department made a positive impact on families and communities. So as we look at the 2024 budget, there were many meaningful investments for Medicaid rate increases, behavioral health services, foster care rate increases, direct care wage increases, community violence intervention, and more, which will again result in significant outcomes in the state. And I'd like to thank all of you and your colleagues for your partnership and support in making all of these outcomes possible. The department's current year budget includes strategic investments in various priority areas, including keeping kids safe and expanding access to health care. This year's budget includes $279.7 million, $25 million of general fund to expand the number of certified community behavioral health centers by an additional 17 sites, bringing the total number of sites in Michigan to 30. We are also grateful for the $22.5 million general fund investment to improve monitoring and response to environmental public health threats, investigate water contamination, and support Michiganders impacted by contaminated water. We are currently working on environmental health threats in over 100 different Michigan sites. One-time funding of $61.4 million general fund that supports the Filter Safety Net program, which will provide a water filter and replacement cartridges to homes occupied by children or pregnant persons enrolled in Medicaid. This program will assist over 70,000 households in limited communities beginning in April, and will ramp that up to full implementation by October. The budget also provides an increase of $25 million general fund to support local public health departments to fulfill their statutorily mandated services related to drinking water safety, infectious disease control, food protection, sexually transmitted infection control, and prevention. Prior to this investment, funding for local health departments had remained flat for almost 2 decades. As you know, our foster care system relies on families to provide children who have been removed from their homes with care. The fiscal year 24 budget implements an 8% increase in regular maintenance payments to foster parents, adoptive families, and juvenile guardians. This is an increase of around $20 million. To improve access to health care, current year budget includes funding to implement the following Medicaid rate increases. A 7.5% rate increase for professional services, 10% rate increase for anesthesia services, a 10% rate increase for home health agencies, a 260% rate increase for traumatic brain injury, and increases for psychiatric beds and trauma centers in hospitals across the state. To strengthen the workforce, wages for direct care and non-clinical care staff employed by skilled nursing facilities were increased by 85 cents an hour, which builds on the previous year increase of $2.35 per hour for direct care workers. The fiscal year 24 budget also added about $65 million for Healthy Moms, Healthy Babies to expand evidence-based services for at-risk populations to improve outcomes. This investment reestablishes the Plan First family benefit, filling a coverage gap for people who exceeded the income limit for the Healthy Michigan Plan but lacked insurance for family planning services. The Children's Special Health Care Services Program coverage was extended from 21 to 26 years of age, providing coverage to an additional 9,000 individuals and aligning our coverage with federal standards. To help local organizations address violence in their communities, the department awarded $7 million in funding to 8 organizations through a competitive RFP process. $10 million in general fund supported a respite care network to provide temporary occasional relief for foster parents. Contracts with UP Kids, Child and Family of Northwest Michigan, and Ennis Center for Children have been established to provide respite support in northern Michigan and mid-Michigan. An additional RFP will be initiated later this month to support additional regions across the state. As part of juvenile justice reform efforts, the current budget includes $31.5 million in general fund to increase state reimbursement from the Child Care Fund for in-home services from 50 to 75%, which provides a financial incentive for youth to remain in the community. The new rate was implemented October 1st, 2023, and was one of the first Governor's Task Force recommendations to be implemented. The fiscal 24 budget also includes $41 million to implement recommendations of the Racial Disparities Task Force. Funding supports 19 mobile health units across the state, with the first starting in July. 23 neighborhood wellness centers will open by the end of March. Funding for healthy community zones will initially be used to implement food security as well as build environmental, physical activity, and social cohesion strategies in Chippewa County, Saginaw County, and the city of Detroit by this fall. These are the first cohorts of several areas in Michigan identified, and these cohorts have higher rates of chronic disease prevalence and mortality and have been historically underserved, excluded and disadvantaged by policies, practices, and systemic racism, leading to continued health disparities and inequities. So I know that's a lot, but I'm not even close to done yet. So let's talk about fiscal year 2025. The recommendation for the department is $37.7 billion in total, $6.7 billion in general fund. This includes $37.6 billion ongoing funding and $112 million in one-time funding, and accounts for almost 16,000 FTEs. The budget recommendation represents a 5.5% change from our current year total budget, 3.7% change from the current general fund budget. As you can see by this pie chart, the recommended budget includes 71% federal funding, which is by far the largest source of funding for this department. The general fund makes up 18% of this budget. The majority of our general fund allows the state to match or access federal funds for Medicaid, the Food Assistance Program, Temporary Assistance for Needy Families, or TANF, foster care, and other federal funds. The remaining general fund supports areas like our state psychiatric hospitals, programs for people experiencing homelessness, mental health services, local health departments, lab services, and other services that improve the health, safety, and prosperity of our 10 million residents. This slide shows the breakdown of how our funding is used, and you will notice that the largest percentage goes to health and aging services, followed by public assistance and behavioral health services. And again, much of this is supported by federal funds. I would like to point out specifically, however, that child welfare makes up only 4% of this budget. So let's talk about 2025. The budget proposal before you focuses on 5 primary areas, including keeping kids safe, expanding behavioral health access, strengthening Medicaid coverage, assisting families, and supporting the healthcare workforce. The investments included in this budget proposal support preventive programs, stability of services, and cost-effective approaches to meet the needs of people across Michigan. One of my top priorities as the director is keeping kids safe. The best way to keep children safe is to provide meaningful, timely, and effective services and supports. In fact, if we can provide families with economic support, it's more likely that kids can remain safely with their parents instead of being placed in foster care. And if a child is removed from their home, our responsibility is to provide support so that kids can safely be reunified with their parents. I think this proposal demonstrates our ongoing commitment to all the children in Michigan. The first investment that we are requesting here is related to the Modified Implementation Sustainability and Exit Plan, or MISEP. So, Michigan has been under federal court oversight for about 15 years because of a lawsuit that was brought by Children's Rights, which is a national advocacy organization. The state and Children's Rights jointly submitted the modified plan to the court in 2019, and the judge approved that plan, which outlines 74 provisions the state must complete to exit court oversight. The MISEP established performance standards across a variety of state responsibilities to minimize the risk of harm to children. Last year, as a result of the significant progress the state has made, Judge Edmonds requested that the state and the plaintiffs renegotiate the MISEP, which we spent about 6 months doing, and I would like to recognize our partnership with the Attorney General's office and our attorneys for their great work on this. And last month, the judge approved a stipulated order scaling back many of the provisions of the MISEP. So this new agreement reduces the number of provisions from 74 to 23. It allows the state to completely exit 31 of those provisions and no longer requires monitoring of about 20. This is huge. This is really, really huge. The $10 million that we've included in this recommendation will allow us to work toward implementing steps we think we need to achieve the remaining MISEP benchmarks through program and staffing, which includes resources, training, and legal services to achieve stable long-term care for children. And more information regarding MISEP and details on this Keep Kids Safe agenda is on our website. The department licenses child caring institutions for the purposes of caring for and supervising children on a 24-hour basis for both foster care and juvenile justice youth. MDHHS contracts with approximately 35 providers, providing $100.5 million annually in funding to those providers. We have heard from them that the rate structure that we have had historically is complicated, and it is, with 30 different rates and varying requirements. The current model makes it incredibly difficult for providers to predict the level of funding that they will receive in the long term. The even more significant issue that we have, though, is that while the department has nearly 900 beds on contract, we consistently face, and you consistently hear about, placement challenges, even as the number of kids that are cared for daily in these facilities is around 500. So this $38 million request, which includes $30 million in general fund, for child caring institutions will transition to a new funding model where the state will pay for a steady supply of beds instead of paying only when the services are being utilized. Provider contracts will be restructured based on the needs of the kids across the state while providing financial certainty to providers. In addition, the fiscal year recommendation includes boilerplate to support consumer price index increases annually for those rates. The state continues to make improvements to its juvenile justice system. The Michigan Task Force on Juvenile Justice Reform made recommendations to safely reduce placement of children in detention, reduce racial and ethnic disparities among youth in the system, and improve the system overall. A couple of the successful initiatives implemented so far. I'm not surprised that was you. Okay. A couple of the successful initiatives implemented so far include increasing the rates for community-based services and using needs assessments to determine where and what services kids should be getting. The fiscal year 25 recommendation asks for additional ongoing funding of $6.9 million, which includes $5.7 million in general fund, to implement further the recommendations of the task force, such as risk assessment screening, standardized risk assessment screening, community reentry services, and youth incentives. In addition, the recommendation includes $5 million in one-time funding for infrastructure improvements at the Bay Pine Center, which is located in Escanaba, and supports up to 45 female juveniles, and the Shawano Center in Grayling, which supports up to 40 male juveniles. Another one of my priorities in this role is expanding behavioral health access. I believe that people should be able to receive services when and where they need them. Approximately 22% of adults in Michigan have a diagnosable mental, behavioral, or emotional disorder. But according to a 2019 study, only 38% of individuals go untreated. Those with unmet behavioral health needs are more likely to die an average of 10 to 25 years sooner than the general population. So the 2025 proposal aims to provide necessary behavioral health access to individuals regardless of insurance or ability to pay. In the current fiscal year, the budget added, as I mentioned, $279 million for certified community behavioral health clinics, which we refer to as CCBHCs, that you might be more familiar with that, to become Medicaid demonstration sites. A CCBHC is designed to ensure access to coordinated, comprehensive behavioral health care and is required to serve anyone who requests care for mental health or substance use disorders. CCBHCs must meet standards for the services provided and be able to get people into care quickly, offering an array of services. Among other positive impacts, the initial demonstration alone saw a decrease in the number of people experiencing homelessness, a decrease in time spent in correctional facilities, and fewer emergency room visits for behavioral health. There were 13 sites in 2021, and an additional 17 sites were approved to be implemented this year. Recognizing the importance and the need to continue to build on this model, the fiscal year 2025 recommendation adds $193 million to expand CCBHCs. With the 30 that we currently have, this investment would expand the number of sites and serve a greater share of eligible beneficiaries across the state. Public Act 12 of 2020 established the Michigan Crisis and Access Line, often referred to as MyCal, which allows individuals in crisis to call, text, or chat 24 hours a day, 7 days a week. Anonymous support is provided, including care coordination and referrals to behavioral health services. With 80% of the calls, chats, and texts resolved on the phone, the service has a proven record of success. The first year MyCal was available resulted in over 69,000 calls, and our annual volume for fiscal year 2023 was over 80,000 calls, over 17,000 chats, and almost 25,000 texts. The fiscal year 25 recommendation includes an additional $8.3 million in ongoing general fund, bringing the total budget for this service to $18.6 million, to ensure that the intent of the legislation is met by providing support to those in need and connecting individuals to necessary services. Disparities in reimbursement rates have limited participation in Medicaid programs and have resulted in inconsistent and inadequate access to outpatient behavioral health services for individuals with mild to moderate diagnoses. Medicaid reimbursement for outpatient behavioral health services performed by non-physician behavioral health practitioners, which includes master's or doctoral level psychologists, social workers, counselors, and therapists, is 75% of the medical practitioner rate. The 2025 recommendation adds $36.1 million to match reimbursement rates for behavioral health practitioners with those of medical professionals, with a goal of tackling the equity and rate disparity at the core of this issue. The third major category of budget investment requests aims to strengthen our Michigan Medicaid coverage by enhancing physical health care and providing low-cost care. While there are many investments included in the budget that fall into this category, including extending Medicaid benefits to incarcerated individuals prior to community reentry and funding to offset the elimination of the My Child premiums, I would like to draw your attention to two specific investments in this category. First, currently, Michigan Medicaid serves almost 3 million Michiganders, and the department is currently reviewing proposals for our Medicaid managed care contracts. Based on input from nearly 10,000 enrollees, family members, and healthcare providers, the My Healthy Life initiative, our managed care rebid, has been guided by 5 overarching strategic pillars: serving the whole person, giving all kids a healthy start, promoting health equity and reducing racial and ethnic disparities, driving innovation and operational excellence, and engaging members, families, and communities. The fiscal year 2025 recommendation asks for $19.1 million, which includes $7.1 million in general fund, to provide financial support for implementation of the new health plan contract improvements to meet the overall goals of improving access to childhood immunizations through the Vaccines for Children's program, incentivizing Medicaid health plans to improve food security through services such as home meal delivery, and implementing program improvements and accountability with our contractors. All Michigan moms, babies, and families should have access to appropriate, quality, and timely care, and access to resources that help them thrive. The legislature has continued to support the governor's Healthy Moms, Healthy Babies initiatives with appropriations, and these efforts have supported keeping women covered by Medicaid for 12 months after giving birth, family planning services, the expansion of centering pregnancy sites, and the removal of the 5-year waiting period for Medicaid-enrolled children and pregnant women who are legally residing in Michigan. The fiscal year 2025 budget recommends building on the success of the Healthy Moms, Healthy Babies initiatives by enhancing the maternal infant health program. The maternal infant health program is a statewide, evidence-based, Medicaid-funded home visiting program for pregnant and postpartum women, infants, and their caregivers. Services offered through the program include preventive health services and care coordination through a statewide network of public and private entities. Services are provided by registered nurses, licensed social workers, and other health professionals. The MIHP program is currently located at 98 sites and serves more than 15,000 Medicaid-eligible pregnant women and 20,000 infants every year. The $3.3 million proposed in this budget will increase the reimbursements to agencies in the program and provide additional care management and connection to community-based services. Enhanced care management services include establishing a network of support for housing, food accessibility, education, employment, parenting, and social services. A pilot of the program found that when the enhanced services are reimbursed, people were 27% less likely to be impacted by domestic abuse, 44% less likely to cut meals, and 36% more likely to be seeking a job. In addition to the maternal infant health program funding, a combined nearly $5 million of ongoing and one-time funding will be provided for doulas. Doulas are trained birth workers who provide non-clinical, emotional, physical, and informational support to pregnant women and their families before, during, and after birth. In January of 2023, doula services became a reimbursable service by Michigan Medicaid. There are just over 300 doulas registered in Michigan, and 184 of those are enrolled as Medicaid providers. So one-time funding of $7.5 million general fund is included to continue state grants for centering pregnancy and the regional perinatal quality initiatives. In total, the fiscal year 2025 budget recommendation includes $15.7 million in increased funding for the Healthy Moms, Healthy Babies initiatives. Over $100 million is included in this recommendation to assist families and to realign the Temporary Assistance for Needy Families, or TANF funding, for direct assistance. Michigan receives $773 million in TANF funding, federal funding every year. TANF provides assistance to families for 4 purposes based on requirements that are outlined in the Social Security Act, which include allowing children to be cared for in their own homes or in the homes of relatives, ending dependence on government benefits by promoting job preparation and work, preventing and reducing the incidence of unplanned pregnancies, and encouraging the formation and maintenance of strong families. Over the years, the use of TANF has changed due to budget constraints and competing priorities. The fiscal year 2025 recommendation realigns the funds in preparation for changing direction from the federal government. In terms of public assistance, the budget increases the Family Independence Program payments, extends the lifetime limit of benefits, increases the small child supplemental payments, and expands the RX Kids program. Michigan's poverty rate is currently at 13.4%, which exceeds the national rate of 11.5%. In 2022, the federal poverty level for a family of 4 was $28,000. In Michigan, families who have an income of $11,000 or above are unable to access assistance through the Family Independence Program. There are currently 11,000 families that are eligible for this. With the proposed budget, families making less than $14,000 a year will be eligible for monthly payments of approximately $480, and those funds can be used for housing, utilities, transportation, and clothing. In addition to the increase in the rate and the change in the income threshold, the budget also supports aligning the limit of benefits with the federal 60-month standard. The budget also supports increasing the small child supplemental and moving those payments from an annual payment to a monthly payment. And then increasing the small child supplemental to $150 a month for kids under the age of 6. The budget includes a $30 million increase to the State Emergency Relief Program for eligible families to access emergency financial assistance to help maintain home ownership, pay utility costs, and complete home repairs. This investment will also allow the department to assist homeowners by intervening in the first year of tax delinquency and increasing the lifetime assistance limit to $5,000 to help families and households in need. And finally, this proposal redirects $24 million for RX Kids, expanding on the $16.5 million that was included in the current year budget. RX Kids was designed to help start babies off right and is being piloted in Flint. This pilot program provides $7,500 to a family per birth, consisting of a one-time payment of $1,500 for the expectant mother, followed by a $500 per month payment for the child's first year of birth. The RX Kids funding proposal will expand the program to other areas of the state based on lessons learned from the pilot. And just for your own information, the Michigan State Dairy Store also has a special ice cream flavor, RX Kids. It's strawberry, and it's really, really good if you haven't had it. In addition to the proposed increase in the State Emergency Relief Program noted on the previous slide, the fiscal 25 recommendation also includes funding for housing assistance through the following investments. $3.5 million of TANF funds for case management to families who have approved housing choice vouchers, and $7.3 million to avoid homelessness by providing emergency housing support, expanding family shelters, and providing funding for short-term hoteling. Title 4D of the Social Security Act permits but does not require states to recover the costs of Medicaid births from the fathers of children born to unwed parents. Michigan is one of only 3 states that recover the Medicaid costs, that attempt to recover the Medicaid costs from unwed fathers. This practice disincentivizes dads from establishing legal paternity and in turn limits their financial and emotional investment in their newborn children. The 2025 budget includes $13.7 million, 4.8 of which is general fund to offset the elimination of the Medicaid birth expense recovery program. allowing financial resources from dads to go directly to the child rather than the state. In addition to the redirect of TANF funding, the budget also reflects additional federal funds for summer food assistance to kids. Food insecurity impacts 1.9 million people in Michigan, including 1 in 7 children. From August through May or June, school is an incredibly important, dependable source of food for many kids. That is also why summer food assistance is so critical for school-age children. Michigan receives federal funding from the U.S. Department of Agriculture to support food assistance for low-income families, and the fiscal year 2025 recommendation includes $108 million of federal funding to provide summer food benefits to school-age kids. The new summer electronic benefit transfer program will begin this summer, and this funding is expected to benefit up to 900,000 children, reducing hunger and contributing to positive health outcomes. Finally, we need to continue to strengthen our healthcare workforce. You may recall me saying last year that as I visited with healthcare organizations across the state, the one issue that consistently comes up in every conversation is the healthcare workforce shortage. We continue to work with healthcare partners on this complex issue, but it remains one of the leading challenges for health systems and other healthcare organizations across the state. The department partnered with various organizations to implement some innovative approaches to address workforce concerns, and some of the successes so far include launching a $3 million student loan repayment program for more than 300 behavioral health providers, awarding loan repayment to 75 healthcare professionals working in high-needs areas, collaborating with Michigan State University and Wayne State University to add 24 students to the psychiatric mental health nurse practitioner program, awarding 33 free primary care clinics with over $12,000 each to support practitioner salaries, and providing an 85-cent hourly wage increase to direct care workers. While we have made great strides, this budget proposal includes additional funds to continue to move the needle on workforce needs. One of the workforce initiatives included in this recommendation is to support repaying student loans for nurses. In March of last year, the Michigan Hospital Association reported 27,000 nursing vacancies statewide. In addition to hospitals, nursing homes, and doctor's offices, MDHHS sees the shortage firsthand at our psychiatric hospitals, where on any given day there can be 200 vacancies. This proposal includes $10 million of one-time funding for a nursing loan repayment program. This program will allow for the repayment of nurses' student loans over a 4-year period in return for their commitment to employment. This proposal is anticipated to benefit up to 700 nurses across the state. In addition to supporting nurses, the proposal also requests support for the behavioral health workforce, which includes both ongoing and one-time investments. A total of $500,000 ongoing is requested for grants for continuing education and examination fees for people working in lower earning positions, and $3 million of one-time funds is proposed for Michigan's universities to expand scholarships and internships associated with the behavioral health coursework. As mentioned earlier, direct care workers received an 85-cent per hour increase in this fiscal year, and the fiscal year 2025 recommendation requests an 85-cent per hour increase for non-direct care workers as well. Non-direct care workers in long-term care facilities are those who do dietary workers, housekeeping, and other non-direct positions. Before we conclude, I would like to highlight several other important investments that have been requested in this year's budget recommendation. First, sexual assault and sexual abuse impact thousands of Michigan's residents every year. The department currently provides support to 16 sexual assault nurse examiner programs and 36 sexual assault service providers. The services provided through this program impact 11,000 survivors of sexual abuse and assault annually, and that includes 4,000 children. The services are much more than an exam and can include support services like counseling and crisis support during extremely difficult and traumatic times. The total budget for the sexual assault victim services is $5.1 million this year. Included in that funding is one-time funding and declining fees from criminal fines. These funds will no longer be available next fiscal year, and so this proposed investment is incredibly important because it is necessary to simply maintain existing services for sexual assault and abuse survivors across our state. So this $2 million proposal would make sure that an estimated 11,000 survivors will continue to receive services. And finally, additional ongoing and one-time investments included in the budget include investments for substance use disorder peer recovery specialists to be reimbursed through Medicaid, funding for gambling disorder treatment, ongoing funding for 211 smoking prevention and racial disparities efforts, support to expand on our community violence and intervention grant programs, and funding for family planning services, the National Kidney Foundation, and first responders. I just want to make sure that you all have Sharday Burton's contact information should you have any questions as we move through this process. And I would finally just like to express my sincere appreciation for the bipartisan support over the past years for this department budget and as I've been in this position as director. This fiscal year 2025 budget recommendation before you would allow us to continue to protect public health, continue to improve access to behavioral health resources, strengthen our workforce, and reduce inequities. People across the state are once again counting on us to work together on a budget that addresses the issues that people care about most in their daily lives. As they go about their day trying to put food on the table, take their kids to daycare, get themselves to work and school, and seek health care. We are very, very excited about the proposed investments, and I look forward to working with all of you again this budget process. And thank you so much for the time today, and I think I hit it right at 40 minutes.
Good timing. Yes, thank you, Director Hertel, for that really detailed explanation of, well, highlights of this incredibly large and important budget. I really appreciated, too, the thought process behind the particular investments that you are proposing this year. And I really appreciate seeing the through line of social determinants of health as connected to so many areas, whether it's maternal infant health, family reunification. It's such a critical part of health that I think is, just come to the forefront the last 3 years, and I really appreciate your intentional efforts to connect that in this budget. So I'm going to allow my colleagues to start with some questions. Rep. Green, Vice Chair Green.
Thank you, Madam Chair. Thank you, Director, for being here. It is a great privilege to have you here, but please send our regards to Farah. Normally, I haven't seen her in a couple months, so please let her know we're thinking about her. I have 3 questions, Madam Chair. Just when do you expect us to be, or when do you expect us to be out of court oversight on the child care? I know we would like it to have been yesterday.
Yeah.
But
yeah, the renegotiated MISEP stipulation that the judge signed gives us a path, a reasonable path to expect to request exit in 2026.
Okay.
And that's based on one provision, although I think if we continue to exceed the benchmarks there, that, we have a case where we can talk about exiting potentially sooner. But we really do have a path to a year for requested exit.
great, thank you. 2026 sounds wonderful. Question, slide 24, the summer food assistance.
Yeah.
How does this coincide with the governor's proposal that everybody gets free lunches even throughout the summer? And I think that's in the education budget. So how are those two coinciding?
So we work very closely with education on the summer food programs. This is an additional federal funding to ensure that we can cover more kids for the summer food program. And again, we'll be starting that this summer, and we'll be able to continue to serve all those kids with this proposal into next year.
Okay. And then one last question. How are we doing with C-Swiss, Champs, Bridges? If you remember, my first committee meeting in 2019 was interesting. How are we doing with our technological upgrades, and are we on platform, and are we on budget?
We are on budget. In general, we've implemented an incredibly effective governance process for our IT dollars in the department. And we have been able to stay on track and prioritize audit finding changes and those sorts of things through this process. With CWIS, we're continuing with the implementation of our first module, and we are completing the evaluation of the proposals for the second RFP for the second and third module. So we continue to be on time as we move forward and on budget right now, which I'm very excited to be able to say.
And how long, again, another time frame, rough idea for the full integration of CSWIS?
Oh,
CWIS,
I don't know offhand. We'll get more into that on the IT one, but not fast enough.
Not
as you
fast
know.
enough, yesterday. Yep.
That's right.
Thank you.
Thanks, Rep. Green. Next, we have Rep. Farhat.
Thank you so much, Chair, and thank you, Director Hertel, for taking the time today. You know, I really appreciate the presentation today, especially how you've highlighted the range of services the department is offering, but I wanted to take a moment to also commend your legislative team, Sharday Burton, for really being, at least for me, I can speak for myself, very accessible, very helpful in making sure that we're working with the department on some of the legislations we're working on. So I want to shout that out before diving into a question, because I think I've come to appreciate that the most.
Thank you.
I was wondering, you know, in Wayne County, a big issue we continue to have is obviously the juvenile detention facilities. How, you know, I know it was maybe glanced or brought through or brushed through. How can we continue to partner towards solutions in that front?
Sure, that's a great question, and I didn't mean to rush through it, but it is
Oh, you
such
did.
a complex, broad issue with so many people, so many organizations that are involved in juvenile justice. So while we do the licensing and oversight of detention centers that are licensed as child caring institutions, we're also reliant on law enforcement and the courts on making determinations for where kids should be. Part of the significant recommendations that came out of the task force are really focused on the collaboration and cooperation of all of the entities that are involved, so that we at the state, in the State Department, can get access to the information and data that the counties have on their kids, on their law enforcement, that we don't have at this point. So we continue to make progress. It will be slower than I think anybody wants, but it does require some pretty significant systemic changes between all of those different entities. And I'm really excited to say, though, that everybody who works in this area is going in the same direction, so I think we certainly will see some significant progress. It's just a matter of getting it done.
And to the point, you know, there has been progress made there, and I think that's reassuring for a lot of people. I appreciate the perspective you offered now, and again, shout out to your legislative team.
Thanks.
Representative Bolin.
Thank you, Madam Chair. Thank you very much, Director Hertel and your entire team. You certainly do very important work on behalf of so many in our state, and appreciate that. I have a question that you made reference to declining revenue in the SANE Fund. And can you explain a little bit more why that is and how it ties into the extra investment we've made in the backlog on some of those sexual assault kits?
I can from a high level, but I'm going to turn it over to Amy because we just were talking about this last night, actually.
Good morning. Great question. So as mentioned in the presentation, the $2 million is really to backfill some one-time general fund that we had, and then also the restricted funds from criminal fines that are collected through the justice system that have been declining. Some of that has been COVID-related, is our understanding, and we're continuing to evaluate, you know, what that revenue level will look like as we go forward. But really, that money is just to kind of backfill the declining revenue overall.
Okay, may I ask a follow-up question? And so, like, this is extremely important on the backlog, so that diminished revenue, I mean, has that impeded our ability to make progress because we're waiting on those funds or anticipating them versus just funding it and taking care of the problem?
Yeah, great question. So for 2024, we are at a stable level for 24. We're really asking it for 25. So we'll make sure we take a closer look on the backlog and just to verify. My understanding is we're continuing to work through that backlog as we go forward, but we'll get you some more details on that.
Thanks, Rep. Bolin. Rep. Price.
Thank you, Chair. Yes, my questions and interests, I'm very grateful about your goal of bringing behavioral health reimbursements up to parity with traditional medical. I mean, we know that they're all related, and I think there's a real attention to that as you're addressing this need. My question related to the 36.1 million to align reimbursement rates of behavioral health care practitioners with medical health care professionals. Could you tell me a little bit more about that? Like, how far are we off now, and how much would this investment help us align those reimbursement rates?
So we're at 75% of the full reimbursement rate, and this would align us at 100.
And this would get us to 100%. And then this is to help us address the persistent shortage of behavioral health care providers. Where are we with our shortage, and how do we anticipate this investment would help us meet the need? What sort of impact in terms of retention, recruitment do we foresee this bringing to this need that we have in our state?
I haven't seen data projection on retention and recruitment with this investment here, but what we know is, obviously, if providers are getting higher reimbursements, they're more willing to take additional patients, and that is our goal right now. But specifically on that outpatient side, where we know people are not getting the services they may be needing. So that is our goal, but I think we can probably put together, or maybe I already have, and I have not seen the information that you're looking for.
All right. Greatly appreciate any efforts to help meet that need in our state, so thank you for prioritizing this.
Yep.
Thanks, Rep. Price. Rep. Meerman.
Thank you, Chair Morris. Appreciate you being here as well. Thank you so much. This is a place that a lot of people find themselves in great need, and the department is there to help in those times, so thank you. My question is regards to $2 a care, direct care worker, $2 an hour. It's my understanding that we get some back, and I'm wondering, is there a way to get more of that out into the hands of those direct care workers? It seems like there would be a pretty great need out there that I'm just, I guess, wondering why some of it comes back to the state.
Yeah, that's a great question. So Megan and I were literally talking about this yesterday on how we can ensure that what we're putting in the budget passes through as much as possible or completely to our direct care workers. We have a couple of ideas that we've been talking about in, essentially it will have to do with the way that we contract with the payers who are paying those direct care workers. And as we continue to have those conversations, we will make sure that you are involved in any thoughts and ideas that you have for us on how we can make sure that that's happening. We would love to be able to hear that.
Thank you.
Thanks, Rep. Meerman. Rep. Martis.
Thank you both for coming here today. I particularly appreciate the attention that you're giving to behavioral health, child care, and then often overlooked and undervalued the sexual assault victim services. Also, thank you to Chairwoman Morse for spearheading that in the last budget. I was wondering if you could flesh out a little bit. There were a lot of great investments one time when it comes to combating drug addiction with the opiate settlement funds, dealing with a lot of those issues. I was wondering if you could provide an update of how we're doing with that, and then if there's anything that we need to be paying attention to or helping in this committee, making sure that we're taking care of those folks.
Yeah, that's a great question. The opiate settlement funds are a great opportunity for us to continue to, focus on the services that we need for both prevention and treatment and recovery. I don't have the current year actually opiate spend plan in front of me, and we can certainly get that for you. And I know we've developed it and completed it. We'll share that with you so that you can see it. And if you have other questions, we can talk about that.
Thanks, Vice Chair. Representative Steele.
Thank you, everyone. Thank you for being here today. My question is about the Medicaid redetermination. And right now, there's been some reports in the media showing that there was an increase of private purchasing of these recipients for their own insurance. And I just really wanted to know where we were in the process of redetermination, and if we're going to see a correlation of not using these Medicaid insurances because people are buying their own health insurance, and if we're going to see a reduction in the cost, which that's one question. And the other one is that we're increasing our full-time employees up another 1,000 FTEs, I believe, based on what we have this year. And I know that a lot of these full-time employees were based on this redetermination process. And I would think that we'd be closer near the end, that we wouldn't need more people, that we would probably need less. So I'm hoping to see some savings, and I'm seeing the opposite.
Well, on your first question on redeterminations, we're about halfway there. We've had an incredibly, how much should I say about this so I don't jinx us for the rest of the redetermination process? We've had done really well so far, and then the redetermination process has rolled out really well. The employees working in all of our county offices have just been amazing in getting through those backlogs if they have them and keeping up on eligibility. We've seen just over 500,000 people moved off of Medicaid in this process, and we anticipate maybe around the same number over the next 6 months. And many of those people are going to private insurance, which we assume they would, because so many people lost their coverage during COVID, which is how our rolls ended up as high as they were. So I would anticipate that we'll see a reduction in the number of people covered, and that would be reflected in our caseloads when we do caseload consensus in the spring. So that's where you'll see those dollars. As far as the staffing is concerned, I never want to lose FTEs. We don't have enough employees no matter what. So whether or not they stay in eligibility determination or we see the need in children's services, I don't know. I can't tell you whether or not all of them will be rolled off. It wouldn't, it's just dependent on where our needs are. I don't know if you want to speak more directly on the FTEs that are included, but I'll keep and take as many FTEs as you want to throw our way.
Yeah, certainly we would continue to look at the FTEs. This current budget before you does include an increase of 68 FTEs associated with the investments we talked about. But as you mentioned, we continue to look at FTEs and see if we can move them into other areas as needs arise as well.
Just can I do a follow-up? Can you tell me how many of those positions are actually filled out of the 15,000? Are they, I know that there's you put that number, but that's not necessarily how many that you have filled.
If I had to guess, I don't have today's data, 400 to 500 vacancies. That would be my guess. 400 to 500, almost 300 in children's services alone.
Thank you, Rep. Steele. I'm going to ask our final question of the morning. So we talked about MISEP, and part of the success there that we've had is focusing on family reunification and putting a lot of efforts towards that, which also we see in the juvenile justice system with trying to reduce the number of kids in residential, increase the child care fund so they have the services they need to be at home. But I want to know if you can sort of lay out what services have done the most to support success in family reunification? Can you identify what things actually make the largest difference?
I can, but not right now. And I'll tell you why. I have to look back. So we really came to recognize providing these social determinants as a key piece of keeping families together or reunification over the past year. And as a result of that, we have been working in a new model of how we work with families who may be entering the child welfare system with our family impact teams. I think that's what they're called, the FIT teams, where we embed an eligibility specialist in with our child welfare workers. And we actually started that last August in, I think, 13 different counties. We assisted over 500 families. We can get you the data on what services we had to provide assistance for. It will not surprise you. Things like housing, probably near the top. Stable housing, as you know, and we've talked about a lot, is such a vital piece for families to stay together. And then we found other things that may be kind of surprising to you, like access to a washer and dryer. is really important, because when kids are going to school with clothes that are unwashed, we end up getting calls for neglect. Poverty is not neglect. And we need to make sure that we're doing what we can so that families have access to the services they need, so that they are not coming to the attention of our mandatory reporters. So we'll get you the data from that for sure.
Thank you so much. I'm so glad you said that, because I was at an event and they talked about the statistics regarding why families are reported to Child Protective Services, and the number one reason really was poverty related, and that's horrifying. It's truly horrifying. So I look forward to receiving that. Thank you so much. I just want to assure my colleagues that over the next few weeks, we will be talking about many of these subjects in detail and having experts come and talk to us and organizations that are engaged in this work, so we have a more thorough understanding of what the community needs are as we prepare this budget. So I want to thank Director Hertel and Deputy Director Epke for joining us today, and your whole team. We truly appreciate the incredible work you do and all you do to make the lives of Michiganders better. With that, Rep. Skaggs moves to excuse absent members. Hearing no objection, absent members are excused. And seeing no further business, this meeting is adjourned.